Today, the CEO of Tivity Health is bringing us the business edge. Donato Tremoto, considered one of the most influential leaders in the healthcare industry and also a turnaround specialist, is here now. Your company, Tivity Health, is increasingly a major player in the healthcare space. You do something unusual. You found a way to meet consumers' needs. Tell us more.
Yes, it's funny, a number of years ago, and in my book that I wrote, I talk about this consumer empowerment. And for many years, we've talked about getting consumers engaged, and I quite frankly think that that's insulting, because consumers who are choosing healthcare products are the same consumers that buy cars, the same consumers that buy homes. And so we need to empower our consumers with the information that can help them to live a more healthy and productive lifestyle. And that's what Tivity Health is all about. We are addressing areas like food insecurity, inactivity, and loneliness and social isolation, and helping seniors make choices so that they have more healthy days than unhealthy days.
Tivity Health recently acquired Nutrisystem. I believe that's number 49 among your merger, sales, and acquisitions. That is staggering.
Well, when I say 49, that's 49 in my lifetime. And so, running Tivity Health, this was the one acquisition that we have been focused on for the last few years. Listen, one of the things I've learned about making acquisitions, and I did fail at my first few, was that culture. Making sure that you get the culture right. If you get the culture right, everything else will follow. And I could not be more pleased. We just released our first quarter earnings last week, and we are already ahead of schedule in terms of the integration and how we're bringing the two companies together. And that really does reflect on the quality of leadership that we have in the organization, and the mission-driven approach that both organizations brought to the respective companies when they were separate, and now the ability to integrate that mission-driven focus remains even stronger today now that we're one company.
Tell us more about how your company fits into the marketplace. You talk about the healthy, stable, chronic, and severe chronic. Explain, please.
It's very interesting. Before we made the acquisition of Nutrisystem, everyone thought that we only had 15 to 15.5 million members, which would be the membership that's in our SilverSneakers product. We actually have 75 million members on a highway. And on that highway, you have those that are healthy, which is about 50% of that 75 million. You have about 35% that I categorize as stable chronic. And then you have about 15% of that total 75 million that will be your more complex chronic. And that is true of any population that you're dealing with in healthcare. And we have a quintessential opportunity now to keep those who are healthy from moving into the stable chronic bucket, keep those who are stable chronic from moving into the complex chronic bucket, and helping to manage the costs with our complex chronics. And so we are one of those few healthcare organizations now that are addressing with our partners the social determinants of health.
SilverSneakers is one of your most popular programs. Why is it such a key piece to your business?
SilverSneakers was started in 1992 by a wonderful woman named Mary Swanson. Her father, Richard Swanson, had had a heart attack at age 51. And the doctor had shared with Mary and her father that if you want to really live a long life, you have to get active. And Mary Swanson brought her father to a gym, and the quality of how this gym was approaching an older person who had a chronic condition did not meet the standards that anyone should be having. And so Mary Swanson came up with this great idea about SilverSneakers. Let's aggregate gyms and fitness centers and help them get trained on how they should deliver the fitness programs to an older person living with chronic conditions. Now, fast forward 27 years later, we have 16,000 fitness centers throughout the United States that participate in SilverSneakers. We have nearly 15 million eligible members that are comprised of about 67 healthcare plans that are committed to the program. I have had an opportunity to meet about 10,000 of our members at these fitness centers, and let me say to you, it's not just about bench pressing 150 pounds for the seniors. It is also about social connections. Our oldest member, Van Smith, who passed away last year, Van lived to be 104 years old. She started the program at 89, and I can assure you that she wasn't going there simply to bench press. She made about 80 new friends, and so the opportunity to get a senior out of their home and to be active and to meet other seniors and to share their stories, this is about as much as brain health as it is about physical health.
You also take a unique approach to what's going on in rural America.
I have been very passionate about rural America. My father died in 1992 and my mother died 6 months later. They lived in a rural area. My mom died of a broken heart. She was all alone. She lost 40 pounds in that 6-month time period. I missed all the warning signs of my mother's loneliness. And if you're living in rural America, and you've lost your spouse, and your children have moved away, and your keys to the car have been taken away, you probably are suffering from loneliness. And if you are lonely living in rural America and you're 65 and older, you have probably a 60% chance that you have diabetes, a 20% chance that you have high blood pressure. And so it's about time that we bring loneliness out of the closet, that we make it a comfortable topic to talk about, that we address this food insecurity. 13.5% of our population are food insecure. Where you live, where you play, where you age, probably has more impact on your health outcomes than your genetic code. And fortunately, the health plans and Medicare are beginning to recognize that if you want to really address health, you have to address these social determinants. And I would protest to say start in rural America. You can get onto our website, Tivity Health. If you Google Tivity Health, it'll take you to our website. And what I would really challenge anyone who's 65 and older, or you're about ready to turn 65, is to check on our website the health plans that offer SilverSneakers, and to encourage your friends to get active, not just physically active, but socially active.
Well, thank you for spending some time with us today.
Thank you, and make it a great day.
Check out businessfirstam.com to find out where to see our entire show. And don't forget to like, follow, and share Business First AM.